Well, hello, everyone. I'm Jessica Vanderkolk. I'm a public information officer with our countywide Calhoun County COVID-19 Unified Response. I'm here today with our two other public information officers and representatives from the Calhoun County Public Health Department to talk about a big issue with COVID-19 right now, and that is the vaccine and what's happening locally with the vaccination process. We want to give some information about getting your vaccine locally and also answer some questions that we're hearing from everyone. So first, we'll just introduce everyone on this recording real quick. And I will just go across my screen and start with Eric.
Well, hello, my name is Eric Pessel, and I am the health officer for the Calhoun County Public Health Department.
Thanks, Eric. Victor?
My name is Victor Jovanovich. I'm the PIO for the Public Health Department of Calhoun County.
Thank you. Lucy?
I'm Lucy Blair. I'm Communications Manager for Calhoun County.
Thanks. And Dr. Nettleton?
My name is Dr. William Nettleton. I serve as Medical Director for Calhoun County Public Health Department.
Well, we appreciate everyone being with us for this recording and everyone that is watching it. So we're going to jump right in with one of the biggest questions everyone has in the county, and that's how to get the vaccine. And Eric's going to lead us through where we are in the phasing process and who is getting the vaccine right now and how you go about doing that. Take it away, Eric.
Okay, so, excuse me, first of all, just so everybody understands that the way the vaccine is being rolled out, both nationally in the state of Michigan and then here in Calhoun County, is going to be in a phased approach. And the first phase, it was called phase 1A, were those highly critical medical field, medical hospital workers that were right up and close, working alongside and with COVID positive patients. And they were real high risk. And they were considered real high on the list to get the vaccine. Also in the phase 1A is our long-term care and our nursing home, both residents and staff. Again, that's that high risk, and it's the folks that we want to get the vaccine into first. There was also in the phase 1A, first responders, and of course those folks like public health that are going to be vaccinating people that are coming through to get the vaccine are all being vaccinated in phase 1A. And recently the governor announced last week that we're moving into now we can start to vaccinate phase 1B. So as we finish up phase 1A, and we still are doing here in Calhoun County, we still have phase 1A groups. There's still some doctors' offices that need to be finished up and a couple other medical field personnel, type of personnel. But as we're completing those, we are starting to schedule our phase 1B groups. And some examples of phase 1B and probably the highest risk group in phase 1B is our 65 and older, or our seniors. And we have started to schedule our seniors with, we have four vaccine clinics scheduled for our seniors so far. Our limiting factor right now is just to have more vaccine. We have a waiting list for our seniors. And if you want to get on that waiting list to get vaccinated, if you're 65 and older in Calhoun County, you can dial 269-441-0912 and leave a message, and somebody will call you back to let you know that you are on the waiting list. And when we have vaccine and we can schedule your next appointment, we will, and we'll contact you and let you know when that's going to be. And we have quite a few people on the waiting list, so everybody's pretty excited, and we're excited that those of you that are 65 and older are really excited to get the vaccine, and that's a good thing for all of us in the community. And we're going to work through you as fast as we can, but we do need to have vaccine to do that. So that's our limiting factor right now. But as we get more vaccine, we'll add more clinics on the schedule. So like I said, we're starting into phase 1B now. Other groups in phase 1B, teachers, daycare, law enforcement, other frontline staff that are exposed to the public, if you will, or work directly with the public, food service workers, your grocery store workers, those folks are all in this large group of 1B. And so we'll prioritize, and certainly, like I said, that 65 and older, probably our teachers and our daycare folks are going to be pretty high on that list to be the next in line to get the phase 1B, but we'll work through that. And then, the process for you, if you're the employer of a group of 1B, whether you're a school or you are let's say you're a grocery store manager, we will have a system set up. We don't have it yet. It's coming soon. I hope by tomorrow. But our website, you'll have a form that just for 1B groups that the employer can fill out. And it's a real simple form. It answers a couple questions about who you are, what you're doing, why you think you should be in 1B. And then it gives your contact information and how we can call you back or contact you back. And then when the time comes and you are where you should be and you are a 1B group, then we will contact you and schedule your appointment. So individual employees do not need to fill the form out. It's just going to be for the manager, the owner, the director of that specific 1B employer. And then we'll be on the list. And as soon as we can get to you, we'll schedule it.
And Eric, while we're still on the subject of how people get the vaccine, what kinds of personal information will the health department ask people for when they're being scheduled? Do they need any documentation or proof of insurance or things like that?
Very little personal information. We need your name, your date of birth, and I believe that's about it, is your name and date of birth. We are not taking your insurance information. We're not billing insurance. So it's just a real simple process. You'll fill out some paperwork as you come into the clinic, and it's a name, date of birth, and that's about it.
That's great. Thank you. And now we know that obviously, Eric, you have received the vaccine already, and Dr. Nettleton as well. And it would be great for everyone to hear your experiences getting both the first and second doses of that. Dr. Nettleton, do you want to start about how that went for you?
Sure. After my first dose, I had a sore arm and a headache the next day, and then both had resolved. The second dose, I also had a sore arm and slightly less of a headache, and that was just for the day after. So the experience went well for me in terms of the process and the flow, and that was my personal experience.
Thank you. How about you, Eric?
Yeah, my experience was even less than what Dr. Nettleton described. I had a sore arm the first dose, and that lasted for the rest of the day of the day of the shot. You can see the picture in my background. And then by the next morning, that sore arm started to resolve itself, and by midday, I would say it was gone. And I did not have any other symptoms like a headache or a fever or anything like that. And then in the second shot, I had even less of a sore arm. It didn't even, I'm not even sure I could call it a sore arm. I knew that I got a shot, but that was about it. I could lift my arm and move it around and do whatever I needed to do. And then I never had any of the secondary symptoms of a fever or chills or anything like that. So it was a pretty smooth process for me as well.
Great. Thank you both. We've collected some questions and concerns that we've heard from folks so far as we go through the vaccination process. And Dr. Nettleton, I will read off these questions, and if you could address them and give people a little information on each one, that would be great. The first one of those is, if someone had COVID-19, should they still get the vaccine when it's their turn?
The answer to that question is yes. So you might wonder, well, why is that, Doc? I thought I was immune after having COVID-19. We think people likely do have some extent of reduced risk of being reinfected after being sick with COVID-19. We think that we give that 90 days or so that you may have that protection, but we just don't know. And we do recommend, medical and public health professionals do recommend receiving that dose to ensure that you are protected. We don't know how long you're protected after being infected, so this is another way to ensure that you are protected.
Great, thank you. How about for someone who is pregnant or breastfeeding and whether they should get the vaccine when it's their turn?
Great. Oh, and just to clarify about that 90 days, you may elect for in that first 90 days after being sick with COVID to not be vaccinated. That's not that there's some sort of reason not to be vaccinated. It just opens up the dose to someone else to receive the vaccination who may not have that minimal protection that you may have immediately after you recover from disease. So I just wanted to clarify that point. But if you'd like to, you can receive it once you've recovered from COVID-19. Yes, lots of questions about those who are pregnant, those who are breastfeeding. So let's talk about what the science and the data says. So the trials for both the Pfizer and the Moderna vaccine didn't include enough people who were pregnant or breastfeeding to make conclusions about the safety or effectiveness in those populations. That's just the evidence in the scientific part of medical trials and how they work. However, when we're concerned about people who are pregnant with vaccines, it's about live vaccines, such as MMR or the chickenpox vaccine. We try to avoid giving those in pregnancy because there's some theoretical risk to moms and babies, but even that's very small. But it's important to know that both these COVID-19 vaccines that are available, the Moderna and the Pfizer, are not live vaccines. What it is, it's a instruction booklet. It's the code of proteins that are surrounded by a fat layer that when it's injected, it tells your cells how to make proteins or antibodies that protect you from being infected from COVID-19. So that's how it works. So you might ask, well then, should I get the vaccine if I'm pregnant? And this is thinking about your risk. Thinking about what do you do? What is your profession? Particularly if you work in medicine or are in close contact with folks who may have COVID-19, that increases your risk for having severe COVID-19 disease. And we know that pregnant women have more complications from COVID-19 if they get sick. It's also thinking about your community and where you live. How widespread is COVID-19? COVID-19 is still widely circulating in Calhoun County, for example. That increases your risk of being infected. And it's balancing knowing about those risks with what we know about the vaccine. So those are the considerations that you and your doctor or your public health professional or nurse can kind of weigh. With respect to those who are breastfeeding, again, there is no reason why this type of vaccine would be expected to harm you or the baby at this time. Again, this is protein that's surrounded by fat that tells cells how to protect you from getting infected with COVID-19. And so there's not a scientific reason that you shouldn't be vaccinated while breastfeeding, but it's one of those things when we do in trials, we just haven't studied it. And so I know that's kind of a nuanced difference out there. So my wife is lactating. If she was eligible for the vaccine, I would recommend for her to receive the vaccine. And then for those who are pregnant, it's again weighing that risk. What's happening in the community? What do you do? What is your risk? And knowing that if you get sick with COVID-19 while you're pregnant, you are at higher risk for having those complications, such as being hospitalized. So every pregnant woman and lactating woman should be offered to receive the COVID-19 disease. There is no medical reason for you not to receive it.
Thank you for that great explanation. Now we've heard from some seniors who are eligible for the vaccine in this phase 1, but have concerns that the vaccines have been developed too quickly and that perhaps it's not safe yet. What kind of advice would you give to folks with that concern?
Sure. So way back in January, when the virus was discovered, its genetic sequence was posted online, and scientists all over the world had access to that and could hit the ground running to start the scientific and medical trials. This is different from using a live virus. That takes time to develop in the laboratory, it takes time to develop all those processes. So the scientists were able to hit the ground running because we knew the genetic sequence posted online. There was no compromise in the safety assessment or the effectiveness assessment in the trials. This was just an innovation to use this technology to develop the vaccine. And it is quite something that we're able to do this. But it's important to know that literally tens of thousands of individuals received either the Moderna or the Pfizer vaccine as part of those clinical trials. And those clinical trials evaluate both safety and effectiveness. The conclusions from both of those large trials was that both of these vaccines are safe and effective.
Great, thank you. Now, you and Eric both talked about some minimal side effects from receiving the vaccine. How are you speaking to folks about what other side effects they could experience, especially for those who do hesitate to get vaccinated because they're worried about those side effects?
You can think about these side effects as your body's way of protecting yourself from COVID-19. It's what's known as an immune response. This is what we expect your body to do, to be, quote, primed. We're priming the pump for your body to protect you for if you are exposed to that virus that causes COVID-19. And these side effects, or this immune response, is fairly robust and common in those who receive either the Moderna or the Pfizer vaccine, which include, as I mentioned, that sore arm, headache, sometimes fever, feeling kind of lousy or kind of run down, and some chills as well. That's your body's way of ramping up your immune system to protect you if you are eventually infected. So that's the way I would think about it, and that's how I counsel my patients, is that this is fairly common, but it is expected, and it's your body's way of protecting yourself.
That's great. Thank you. And the final one is, you've talked a little bit about this, especially with the folks who are pregnant or breastfeeding and the considerations they would make in getting vaccinated. Are there other pros and cons that you talk through with people to getting the vaccine, perhaps especially for an elderly person or maybe someone else who just has a concern about their risk there?
Sure. So we know that COVID-19 is a serious, severe infection. It can lead to hospitalization and it can lead to death. We know that, and we've seen it happen in our community. And the virus is still circulating in our community, and it is not going away anytime soon. This is why vaccination for all those who are eligible is so important. There's only one medical reason not to receive the COVID-19 vaccine, and that is if you've had a history of a severe allergic reaction known as anaphylaxis to any of the ingredients in the vaccine. And you can talk to your public health nurse or physician about what those ingredients may be. There are some precautions to consider, such as have you been vaccinated with any other vaccine in the last 14 days? You can still be vaccinated. We just don't know if the vaccine will be less effective or interfere with the other immune response of those vaccines. You can still receive it. It's just one of those things where we don't know. For those who have received that antibody treatment, which is through an IV, for those who are sick with COVID-19, there is a recommendation to delay vaccination for 90 days for those who receive that special antibody treatment through an IV, because we don't know how the vaccine will interfere with that treatment of antibodies that you receive to treat yourself. There are a couple other precautions that you can talk about with your nurse or physician, but those are kind of the main ones. For those who are 65 and older in particular, those folks, includes my parents, includes my grandmother, are at very high risk for severe complications. That's where we see people be hospitalized the most. That's where we see the most death happening in our community. We know that about COVID-19. The COVID-19 vaccine is a safe and effective way to reduce that risk so we can get back to our normal lives and continuing to function as a community.
Thank you so much. And you really just kind of moved into our next section here about why it's so important to get the vaccine. Can you also talk about too why it is still important for everyone to continue to wear a mask and social distance, even if they have been vaccinated at this point?
Yeah, really good question. I hear folks say, hey, doc, you just told me this is a highly effective vaccine. Why can't I take off my mask and social distance? At this point in time, we got to think about this as an entire community and also protecting your family too. We got to use every tool we have in our toolbox to stamp out this virus and to stop the spread of disease in our community. And so we got to keep using our masks. We got to keep socially distancing 6 feet, washing our hands. And then also being vaccinated. That's how, what I call plugging the holes in the Swiss cheese for the virus to infect you and your family. Use all the tools we have. You think about it, when you go out to the grocery store, you're not going to know yet who has been vaccinated. It's going to take time for us to move through these spaces and vaccinate the entire community about who is eligible. There's still also an epidemic order to wear masks as well. So as we move into 2021, as more of our population becomes vaccinated, I anticipate later in 2021 we can begin to relax on those restrictions, but we're just not there yet. We still got to stamp out this virus. We still got to use every tool we have in our toolbox, and that vaccine is a very powerful tool to protect yourself and your family.
That's great. Thank you so much. And Eric, what kind of timeline might you expect for mass vaccination in Calhoun County? Do you have any indication of what the rest of the county beyond phase 1 might be looking at?
Yeah, so, on our website, we have things kind of timelined out a little bit. If you go to our vaccine webpage, we will give you an idea on the calendar of when we might get to what we call the phase 2, or everybody else, as we like to put it. Everybody that's under the age of 65, has no underlying health conditions, and older than the age of 16. That particular group that I think you're talking about, it will be more than likely, and I would rather we be more conservative right now than bold. So I would say that it's probably sometime this summer when we get to that group and be able to do some real big, large mass vaccinations. Maybe late spring, early summer is when we might get to that group. This group 1B is a very, very large chunk of our population. So we're looking at just the over 65 is somewhere around 26 or 28,000 people, citizens of Calhoun County. So it's a large group when you add in all the other workforce that essential critical workforce. And it's going to take us some time to get through that group before we can open it up.
Right, thank you. Well, I believe that brings us to the end. So I thank you, Eric and Dr. Nettleton and Lucy and Victor. Have we missed anything? Is there anything else anyone wants to jump in with before we conclude today?
I would like to add that as we were talking about our 65 and older and using the phone number and getting on the waiting list, and I just want everybody to know to please be patient. We are getting an exorbitant number of phone calls, and the folks are working as fast and diligently as they can to clear off the voicemails and listen to them and make sure that you're counted. And then please understand that you don't need to call back. We will reach out to you. It's happening within 24 to 48 hours of you leaving the message. You'll get a phone call. It's a system generated phone call that will let you know that you're on the waiting list, and then you can just wait to hear from us then. But please leave those phone lines open for people that haven't called yet. There is no reason to call more than once, and once you leave that message, you should hear back from somebody within 2 days. And if you hear back, that means you're good and you're on the list, and then we'll get you scheduled when we can. Thank you.
Great, thank you for clarifying that, Eric. Victor, Lucy, and Dr. Nettleton, anything else to add?
This takes an entire community, and we're getting out there, and we're going to partner, and we're going to vaccinate Calhoun County. And this is so important to help bring this pandemic to an end.
Thank you so much. And I will just plug those websites again that have all of the information. Eric referenced the County Public Health Department's vaccine website, and that is at calhouncountymi.gov/COVID vaccine. All the news and information that we are sending out from our countywide COVID-19 response can be found at calhouncountymi.gov and also at battlecreekmi.gov/coronavirus. So thanks for watching.